You may recall that earlier this year, despite breast cancer status as one of the leading causes of death in women 40 to 49, the U.S. Preventive Services Task Force recommended that women in their 40s stop having routine mammograms. And even though age is one of the leading risk factors for breast cancer, older women from 50 to 74 were told to cut back their screenings to every other year. I brought you more on this report in April. Now you'll hear from Holly, a Florida Hospital Waterman patient and breast cancer survivor, as well as Dr. Krishnan on the importance of screening mammograms.
I do encourage you to get your mammograms because 85% to 90% of breast cancer can be picked up by mammogram. MRI is good, but it's a useful tool in helping us characterize breast cancer. It is not good in evaluating calcifications and other areas, so that's the most important thing. I get a lot of questions on that. Routine mammogram still is the gold standard for women getting yearly screening examinations is the most important thing. The other self-examination and MRI are useful tools, but to prevent, to help us prevent fine early detection of cancer, especially with the statistics of 1 in 9, I think everybody should have the mammogram.
Do not miss your mammogram. Just don't miss your mammogram. I cannot stress that enough. I didn't find anything. I was healthy. I had no issues whatsoever. I only went to the doctor because it was the annual thing you're supposed to do. I had missed mine for 1 year. I was fortunate that they found it was very small. Both my children are aware of the risks, and I would strongly encourage everybody to let your children know what type of cancers are in the family. Don't hide it.
The American College of Radiology and the American Cancer Society for Prevention of Breast Cancer recommend a mammogram at the age of 35, followed by a mammogram at the age of 40 if everything's okay at 35, and then yearly mammograms to the life expectancy of the patient. For patients who are high risk, meaning like maybe their mother, grandmother, aunt, maybe they have 2 or 3 relatives, they sometimes, I even see them at the age of 30 or 32 just to get a baseline.
You'll learn more about the services offered at Waterman Digital Mammography Center when you click the Clearing Confusion story link icon on yourhometownhealth.com.